Hi. Let me check if I can record. Record. Okay, everyone, you're welcome to exam review session. Okay, so I hope this you're getting to watch this video from the YouTube live or you're joining on our Zoom. You're highly welcome. Okay, so we recently had a pharmacology exam. It was last week on 14th of June 2025. So and we had, if you have been following up our discussion on the whole material of pharmacology 810, know you're going to be able to write something or explain something, all right? So you're all welcome. And today I want to do a review of this past question. Like when I saw the question, I did not write the exam. No, I finished all my coursework last year. So when I saw the question, I was so happy. Number one is because the question touched like almost every module. Yes, like they spread the question, unlike during the time for microbiology that um there was no, like, the question was just from a particular module. It was just somehow. But this pharmacology, I was so happy. Like, I was so pleased with the way they said the questions. All right. So today I want us to review the questions and then answer them. And if you're one of those that wrote the exams, I hope this is going to help you maybe to estimate your mark. Okay, so let's get started immediately, all right? So I'm so happy to be live on Zoom. First of all, this is my first time of going like live streaming right from my Zoom to YouTube. So if this is your first time of joining us, my name is Jenina Ezekai. I am a master student of the National Open University of Nigeria, and I just do group discussion with my colleagues on our various courses in public health. Okay, so you're highly welcome. And please don't forget to subscribe to the channel for more and more and more content because there's a lot that's going to be unfolding very soon. Okay, so let's get started immediately on our questions. So the first thing we have, all right. So the first question we have, question 1A. Okay, first of all, let me explain that the question paper has three questions. 1A, and I think each question is allotted marks. All right. So I'm going to be saying the mark of every question and then we'll answer the question. Okay. So question 1A says discuss any three factors that influence the pattern of drug distribution within the body and explain how these factors contribute to uneven distribution across tissues. Pattern of distribution. If you have been following our class discussion, you know that distribution is part of pharmacokinetics. Okay, that is ADME, absorption, distribution, metabolism, and then excretion. ADME, the short form of everything that happened during the pharmacokinetic process. Okay, so and here they're telling us three factors that influence the pattern of distribution. Okay, so if you have not watched that particular discussion we had on pharmacokinetic, I'm going to be leaving the link in the description of this live. Okay, so let's discuss what is drug distribution. It describes the reversible transfer of a drug from one location to another within the body. So after a drug enters the systemic circulation, it is distributed to the body tissues. Okay, so after you've taken the drug, that is absorption through maybe oral or through intramuscular, through vein, like any method you take in absorption, the next process is that the drug will enter the systemic circulation, okay, where it is being distributed to the body. But there's some key factors that determine how these drugs are being distributed in the body. And that's what this question is asking. What are the three factors that influence the pattern of drug distribution within the body? And we also have to explain how these factors contribute to uneven distribution. So the first factor is tisular delivery of drug by blood. So tisular delivery of drug by blood is refers to how much blood flows to a tissue. Okay, so highly perfused organs like liver, kidneys, brain, and heart receive more drug quickly, while the poorly perfused areas like fat and bones receive drug slowly. Do you see how this affects the pattern of drug distribution? Because there's some tissue areas in the body that are highly perfuse. Perfuse means that like they are easily accessible, all right? So like the brain, the heart, the liver, the kidney, they are highly perfused organs. So they receive blood quickly than maybe the fats, the bones in the body. So this is how it affects pattern of drug distribution. So those areas when you take drug, the drug will actually reach those tissues more easily than in other areas. Okay. Then the second factor is the ability of the drug to cross membranes. Okay, so we have that drugs must cross biological membranes, which are made up of lipid layers, to reach target tissues. Okay, so lipid soluble, that is the non-polar drugs, cross easily by diffusion, while the water soluble, the polar drugs, may need transport proteins or pores to cross. So this is explaining that there are membranes in the body, that's biological membranes that have to bound to protect different tissues, all right? So drugs must cross these membranes before they can reach their target tissue. And how this affects that this most of these membranes are made up of lipid layers. And these lipid layers are non-polar. So it's only those drugs that are specific to them or those drugs that are non-polar drugs can easily cross. That is the lipid soluble drugs. Call them the lipid soluble because the membranes are made up of lipid layer. All right. So the lipid soluble drugs cross easily, maybe by just diffusion, the movement of drug from lower concentrations to higher concentration. All right. Why the non-lipid forms? That's those drugs that are really water soluble in nature may need transport proteins, that is by active transport or pulse to cross. So you see how ability to cross the membranes, that's the biological membranes in the body, really affects the pattern of distribution. Okay, so the third factor is the binding of drug with blood and tissues components. Example, because of lipid content, drugs can bind to plasma proteins like albumin or tissue proteins or lipids. Only free or bound drug is active and can cross the membranes. So those ones that are high binding reduces availability and slows distribution. So what is this talking about? There's some tissues, there's some organs in the body that the drugs are sensitive to or are specific to rather, alright? So these drugs, when they are being injected into the body, they tend to bind to those tissues. Okay, so it's only those ones that are only free or unbound that can actually cross membranes. So the high binding reduces bioavailability and slows distribution. Do you understand? Okay, so these are the major factors. And if you are asked this question and you just list maybe three of these, I think I still have more. I still have to list more. I just list maybe three of these or more, say, and explain it the way you really understand. And please note, exam is not for you to write what is really in the material. It's just for you to, okay, did you understand this thing that is in the course material? How are you able to um give give back what you really understand? Okay, so if you're able to explain it in your own way, I think you are good to go. So other factors is positioning between water and fat. Also have his ability, that is drug ability to undergo active transport through cell membrane carriers, especially those ones that are polar drugs, that are the water soluble drugs, which cannot easily diffuse through the cell membranes. Okay, so that's our question 1A. So let me know, were you able to answer it like this or something related to this? Let me know, all right? Okay, so we have 1B. So 1B say define the volume of distribution and explain its significance in drug dosing. Also describe how the volume of distribution varies with specific drugs conditions. You're talking of volume of distribution here. So let's answer, what is volume of distribution? Volume of distribution is a theoretical volume that the total amount of drug administered will need to occupy to provide the same concentration as in blood plasma. So it's not a physical volume. Nevertheless, the volume of distribution of a drug gives information on its distribution in the body. Okay, so it has a formula for calculating the volume of distribution. Its total volume of is equals to total amount of drug in the body all over the plasma drug concentration. That's D over C concentration. That's dosing or dose in the body all over the concentration, the plasma concentration. Okay, so volume of distribution starts to explain that the total amount of drug administered. We need that's the volume that the total amount of drug administered will need to occupy to provide the same concentration as in blood plasma. So when a drug is administered in the body, the whole general body, okay, drug is absorbed, then this blood is, how is it distributed in the body? Is it like evenly distributed, or is it slowly distributed, or like highly distributed? Okay, so the um, um, volume of distribution is trying to explain the total amount of blood. Okay, okay, if the total amount of blood in the body, then those ones in the plasma or in the blood concentration, how are they easily distributed? Okay, so let's talk on the importance in drug dosing. So volume of distribution helps to determine the leading dose. So drugs with a large volume of distribution requires a higher loading dose to achieve therapeutic plasma levels. So what this is trying to explain is that those before a drug can enter the bloodstream, that's the plasma or the blood concentration, right? It means that the blood has been easily distributed depending on the route of administration. You know, most of the drugs that have been taken intravenously just go straight to the bloodstream. So they majorly have a high plasma drug concentration, most of the drugs that are being taken intravenously. But other drugs that are being taken maybe orally, which undergoes a lot of metabolism, especially in the liver, they have to take like overcome a lot of barrier before they can reach the specific tissue or the plasma. All right. So those ones that has a large volume of distribution, especially those ones requiring like those ones with a large volume of distribution, they require a higher loading dose to achieve therapeutic plasma levels. Okay, so the volume of distribution also helps clinicians to predict how much of a drug is needed to achieve a certain plasma concentration. Okay, it also assists in understanding drug distribution pattern, that is whether a drug stays in plasma or it enters tissues extensively. We've explained the factors that actually affect drug distribution in the previous slides in question 1A. So the volume of distribution helps to understand drug distribution patterns. Okay, so these are the significance in of volume of distribution. Okay, so I hope you are really getting it. So just moving on, another key factor is okay. The second question is we should describe how the volume of distribution varies with specific drugs and conditions. With specific drugs and conditions. So we have different drug types, and then I just try to give a general overview of what it means, so of what this question is talking about. So there are different types of drugs, specific drugs. We have the highly protein-bound drugs. We have the soluble lipid soluble drugs. We also have hydrophilic drugs, which are drugs that are water soluble. So how the volume of distribution varies among these various different types of drugs is that those drugs that are highly protein-bound have low volume of distribution, okay, because they remain in the plasma. Example of them is warfarin, okay. Then those ones that are lipid soluble drugs, lipid soluble, which can easily pass through the membranes, okay. So they have a high volume of distribution. They easily distribute into tissues. Example, the diazepam, they can easily distribute into the tissues. Then we also have another type of specific drug, which is hydrophilic drugs. Hydrophilic drugs are polar drugs, which are water soluble. Okay, they have lower volume of distribution and they remain in extracellular fluid. Example is the aminoglycosides. All right. So this is the whole thing that this question is talking about. How does volume of distribution varies with specific drugs? You know that those ones that are lipid soluble, they have high volume of distribution, while those ones that are hydrophilic or polar, they have lower volume of distribution. All right. So that's it about question number one. We have number 1A. Then we also have number 1B. Then let's move over to question number two. The 2A said, explain. Okay, let me check how many marks one carries. So question number 1A, how many marks does it have? It has 10 marks. Discuss the three factors that influence the pattern of drug display. It has 10 marks allocated to it. And the question number 1B has, I think, 14 marks. 14 marks allocated. That is 24 marks per question number one. Okay. So let's move over to question two. Question two said, 2A said, explain the mechanism of action of digoxin in treating congestive heart failure, CHF, and outline its adverse effects. This question is coming from module 2 of the course material, the mechanism of drug action, which is the pharmacodynamics of drugs, okay? The mechanism of drug action of digoxin in treating congestive heart failure. And then we also have to explain its adverse effect. So first of all, what is congestive heart failure? Because before you explain how this digoxin actually treats CHF, you have to know what congestive heart failure is. So it's a chronic condition where the heart doesn't pump blood as efficiently as it should be, leading to a buildup of fluid in the body. So why is a serious condition? It doesn't mean that the stop has stopped working. It doesn't mean that the heart has stopped working, but rather that it becomes less effective at circulating blood to meet the body's needs. So this just means that when you hear of congestive heart failure, it means that the blood is not able to pump as much blood as the body needs, okay? And it is going to cause heart failure. All right. So digoxin is a drug that is being used in treating this congestive heart failure. So this person is asking is how does this digoxin actually help in treating this congestive heart failure? So there are different steps that the drug takes or different actions that the drug actually take. Number one, inhibition of sodium and potassium ATPase, that's an enzyme. So this digoxin, it binds and inhibits the sodium and potassium ATPase pump, which is an enzyme responsible for maintaining proper ion balance across cell membranes. So this pump normally moves sodium ions out of the cell and then potassium into the cell, okay, using energy from ATP. So by inhibiting the pump, digoxin increases intracellular sodium levels. So what happens when this intracellular sodium levels is being increased? The increased intracellular sodium concentration reduces the sodium gradient across the cell membrane, all right? And this reduced gradient decreases the activity of the sodium calcium exchanger, which normally pumps sodium into the cell and calcium out. So as a result, less calcium is pumped out of the cell, leading to an increase in intracellular calcium levels. So what does the calcium levels actually do? The second is positive inotropic effect. So increased intracellular calcium enhances the force of heart muscle contraction by promoting the interaction of actin and myosin filaments. So this contractile protein of muscle cell, the contractile motion of proteins of muscle cells. So this enhanced contraction leads to a stronger heartbeat and improved cardiac output. Do you see the outcome of everything here? Number one is inhibition of the enzyme that is responsible for maintaining proper ion balance across cell membranes by the inhibition, that's the sodium and the potassium ATPase, that's the enzyme. Okay, so what happens is that when this digoxin, that is this drug inhibits this pump, digoxin increases intracellular sodium levels. And when intracellular sodium levels is increased, it actually helps to reduce reagent decrease activity of the sodium calcium exchanger, okay, which normally pumps sodium into the cell and calcium out. So the major aim is to increase intracellular calcium levels in the body. So when this intracellular calcium level is increased, it leads to enhanced contraction, okay? Okay, that actually leads to a stronger heartbeat and improved cardiac output. So that's the major aim of how this digoxin actually help in treating congestive heart failure. So we also have digoxin also slows down the heart rate by increasing vagal tone, which affect the sinatrial and arterioventricular AV nodes. It prolongs the refractory period of the AV node, making it more difficult for electrical impulses to pass from the atria to the ventricles, thus slowing the heart rate. Okay, so this is the mechanism of digoxin action on treating the congestive heart failure. Okay, so we also asked to explain um, what are the adverse effects of this drug. The adverse effect is what's all those unwanted actions that this drug can cause to someone that is taking it. Number one, that is like side effects, all right? Number one is can have visual disturbances like blood or yellow vision, which is called halos. We also have gastrointestinal disorder, psychiatric like fatigue, malaise, delirium, confusion, dizziness, and a lot of them. Pulmonary disease, cardiac arrhythmias, renal insufficiency. We also have hypoestrogenism, especially for women where the estrogen levels in the body are abnormally low. Okay, so this is it about the question number 2A, explaining the mechanism of action of digoxin and also the adverse effects of this particular drug. Okay, so let's move on to 2B. 2B says, discuss the impact of drug use during pregnancy on fetal development, including a short note on teratogenic effects. It's still 14 marks. I think each and every one of them is 24 marks. So 24 times by 3. Okay, just calculate it and let us know. So let's discuss the impact of drug use in pregnancy. Drug can cross the placenta, affect the fetus, that's the developing baby, all right? The effect depends on the gestational stage, the drug type, the dose, and then the duration at which the mother takes the drug, okay? Generally, women who are at risk of conceiving or who wish to become pregnant should withdraw all unnecessary medication 3 to 6 months before conception. This is just a fact that is stated. Every woman, you know that because a lot of drugs, it's just like it stated here, drug can cross through the placenta and affect the growing fetus. And this can lead to a lot of effects. Okay. So the first trimester, especially week 3 to 8, is the most vulnerable for organ formation. That is organogenesis. So at this stage, drugs may cause a miscarriage, an obvious birth defect, or a permanent or subtle defect that is noticed later in life. So it's very, very risky to take anyhow drug when one is pregnant. I think that's just what all this is trying to explain. Then at 9th week, the embryo is referred to as a fetus. Development during this time is primarily maturation and growth. Exposure to drugs during this period is not associated with major congenital malformations, but they may alter the growth and function of normally formed organs and tissues. So taking drug, impact of drug during pregnancy is actually dependent on the gestational age. That's the time as with the mother take the drugs, the drug type, which type of drug is she taking, the dose, at what quantity, and then the duration. How long does she actually take this drug? Okay, but in general, women should not take drug. Women who are at risk of conceiving or who want to give birth should not take. Even mother who have conceived should not take an unprescribed medication. That's what the impact of drugs, because drugs can actually affect the growing fetus. Okay, so that's why I think this one's residual knowledge can actually help you to explain this when it's being asked in exam. Then let's take out on short notes on teratogenic effects. That's what the next question is talking about. So what is teratogen? Teratogen is a medicine or other chemical that is capable of producing a permanent structural or functional birth defect, growing impairment, or fetal death. So it just teratogen is any substance that can just cause a birth defect to a growing fetus. Okay, so they act with specificity to produce a specific abnormality or constellation of abnormalities. Example is thalidomide, which produces phocomelia. I've explained this thalidomide over and over again. It is a drug that was used in the 1960s or 50s by pregnant women. So this thalidomide actually helped those pregnant women to um, like this help them with the morning sickness, the nausea. So it helps to prevent all those morning sickness and nausea. So most of the women that took this thalidomide at that period give birth to children that have a birth defect called phocomelia, like short limbs. I've shown it in one of our discussion when we're discussing on adverse drug effects and adverse drug reactions. Okay. So that's the effect of this thalidomide. So it is a teratogen that can cause a birth defect. So it caused a birth defect on most of the children born by the women that took this particular drug. Okay, so the teratogen they must reach the developing conceptus in sufficient amounts to be able to cause the effect. The effect that a teratogenic agent has on the developing fetus depends upon the stage during which the development when the fetus is exposed. Okay, so this is just trying to explain what teratogen and teratogenic effects mean. Okay, because I told to write a short note on it. So let's list some of teratogenic agents. There is a source where we can actually get it. Number one is from infections. Okay, this is giving a short acronym of TORCH. That is for toxoplasmosis. Toxoplasmosis is a parasitic infection. Okay, so it can happen and when this actually affects a pregnant mom, it can also lead to defect of the baby. Okay, so we have toxoplasmosis for T. Like TORCH is an acronym for these infections, different infections that can affect mother to child. So we also have O, which is other organisms like parvovirus, HIV, Epstein-Barr, Hep 6 and 8, varicella, syphilis, and enterovirus. Okay, then R for rubella virus, the C for cytomegalovirus, then this H for hepatitis. So these are different infections that can lead to mother to child transmissions. Okay, so we also have maternal diet. Okay, so the kind of food that the mother taking, or maybe there's a deficiency in one of the very key important food or supplement that the mother need, it can lead to a defect. For example, the role of low folic acid and neutral to defects. Lack of folic acid, a lot of this folic acid is a supplement that is being recommended for pregnant women. So it can help in the spinal development. So it can lead to neural to defect of a baby when it is deficient. Okay, so we also have maternal drugs. A lot of drugs that women take, like the thalidomide, explained, um, maybe these cannabis, marijuana, cocaine, amphetamine, they can have an adverse effect on the baby. So we also have environmental factors like smoking, chemicals, heavy metals, radiations that can cause death. All right, so this is it about question number 2B, which we have discussed the impact of drug use during pregnancy on fetal development, and also a short note on teratogenic effects and also its agents. So I hope you are really following. So let's go back to 3A. 3A says discuss the effects of heavy metals on human health and provide two examples of toxic heavy metals. What's the effects of heavy metals on human health? So heavy metals are elements that can cause toxic effect in small amounts. So they differ from other toxic substances in that they are neither created nor destroyed by humans. Some heavy metals like zinc that provide a health benefit in small doses can also be toxic at high levels. Okay. So their effects on health could occur through at least two mechanisms. That is, the effects of toxic heavy metals can occur in two mechanisms. Number one, by increasing the presence of heavy metals in air, water, soil, and food. And then the second mechanism is by changing the structure of the chemical. For example, chromium 3 can be converted to or from chromium 4, which is the more toxic form of the metal. Okay. So heavy metal toxicity can result in reduced mental and central nervous function, lower energy levels, and damage to blood, lungs, kidneys, liver, and other organs. So this is the effect of this heavy metal, especially when one has consumed it over a very long time. Okay, so they tell us to give two examples of toxic heavy metals. There are a lot of them. We have lead, we have mercury, we have cadmium, we also have zinc. In as much as zinc is important, can also cause um, um, a toxic effect at high doses. Okay, so we have a lot of them. We have lead. The lead affects the central nervous system, especially in children, kidneys, and also blood. It causes lead poisoning. The source can be from batteries, from paints, and also from pipes. Okay, so we have mercury. Mercury also damages the central nervous system and kidneys. It can be gotten from contaminated fish or in thermometers. We also have cadmium, which affects kidneys as well as the skeletal and respiratory system. It can be gotten from consumption of contaminated food, active and passive inhalation of tobacco smoke. So these are the different the examples of toxic heavy metals with maybe a little explanation about them. All right. So that's it about question number 3A. If you're able to answer something like this or exactly like this, I think your mark will be rest assured for you. Then we also have 3B. 3B say describes the pharmacological action and therapeutic indication of oxytocin in pregnancy. Oxytocin in pregnancy. This is actually gotten from question number 3. Sorry, this question is from still module 2 of the material, okay? Pharmacological actions. The last one was digoxin, but this one is oxytocin in pregnancy. So what is oxytocin? It's a euteronics used in increasing uterine contraction and plays a vital role in modern obstetric care. So it's actually is a drug used in for use maybe when a woman is pregnant. Okay, it helps in contraction, it helps during labor. Okay, to actually help in to fasten labor. Okay, we are going to be seeing a lot of benefits, the therapeutic pharmacological action of oxytocin. So the pharmacological actions are sensory stimuli from cervix, vagina, and breast suckling stimulates the secretion of oxytocin. So this can be stimulated by um, by sensory stimuli from cervix or from the vagina or from the breast suckling can help in stimulating it. We also have stimulates uterine smooth muscle contraction. That is, it enhances level. This is talking about the benefit of this oxytocin. It also promotes milk ejection by acting on myoepithelial cells of the breast. Okay. Then it shortens the stall stage of labor by promoting placenta expulsion. Then in high doses, it causes sustained uterine contractions. All right. So these are the pharmacological actions of how this oxytocin actually help. Then for the therapeutic indications in pregnancy, number one is actually used in early pregnancy. Oxytocin is used to accelerate abortion, that is to stop bleeding following evacuation of the uterus, and used as an adjunct of abortion along with other abortifacient agents. So what is talking about? Maybe when abortion occurs at the early stages of pregnancy, this oxytocin can be used to accelerate it. That is for the evacuation of the leftover um, uterine substances in the body. So oxytocin helps to accelerate abortion. We also have in late pregnancy, it helps to induce labor, to facilitate cervical ripening for effective induction, augmentation of labor, and also uterine inertia. So these are the benefits that to induce labor in late pregnancy. maybe a woman has reached like 39 weeks, 40 weeks, and you want to fasten the labor to induce the labor, you can inject the person oxytocin. You also have during labor, active labor itself, it helps in active management of first stage of labor following expulsion of placenta. The first stage of labor is when the placenta, we have three major stages of labor. Then the third stage is the first stage is the dilution. The second stage is the active delivery of the baby. Then the third stage is the placenta, expulsion of the placenta. So it's actually, this oxytocin actually helps, okay? Because a lot of times when women give birth, they give birth to the baby and you still notice that the placenta is still inside the body. So this oxytocin can help in as to accelerate expulsion of this placenta. We also have in preparing, it helps to minimize the blood loss and control maybe postpartum hemorrhage. Okay. Then in diagnostic contractions, straight test to the determination of respiratory function of the fetal placenta unit during induced contractions. Then for induction and augmentation of labor, which it helps in mild preeclampsia, uterine inertia, incomplete abortion, post-maturity, and maternal diabetes. So it minimizes the blood loss and to control the postpartum hemorrhage, so which I've explained. So these are all the therapeutic actions or the therapeutic advantages of using this oxytocin during pregnancy. Okay. So, and this question actually have 10 marks. That's 22. I think in general, this should be 70 marks, right? 70, 70 marks for the whole question. Then the TMA will account for the next 30 marks. So that is just about the review of the 2025 first semester pharmacology, HS 810 question. So let me know if you write the exam or if you're planning to write the exam. Hope this is very helpful for you. Okay, so let me know which past question or topic do you want us to have discussion on. That's the next one. So you can help me type it in the comment section. And please don't forget to subscribe, also like, and then share this video to anyone that you know that he or she will be very useful to them. Okay. Like I said, there are a lot of things that is going to be coming up in our next discussion, especially when it comes to research and proposal writing. I think I just given you a tips of what is coming in proposal writing because currently about to start writing my thesis. That is my research proposal, and I want to carry everybody along on the processes, the steps, the methods, and everything in between. Okay. So it's only when you are an active a member of this channel by subscribing, which is free, that you can get to know the updates. Okay. So I'm going to be seeing you in the next discussion class. Thank you so much for joining our live, and I wish you a wonderful day.